I wasn't ready.
So, as we progress into here, the next step is going into drip rates. So, this calculation shouldn't be any different than we normally do. What we were doing before is we were going drug for the ordered dose over 1 minute times the concentration, which the concentration is always in milliliters over milligrams. And that would find us the mils that we wanted. Right? That's how you guys have been doing everything, correct? So for our bonus question there, that was in there, I kind of put on the board, the drug that you do pre-RSI, well, I got to be careful so he doesn't hear me in there. So basically, I told you about, so I'm going to write this down. We will give pre-RSI, especially in and the dose ordered that we want to do. That's where we were trying to figure out exactly what we give. But it's is the dose ordered. Okay? And then we have a so that's how much we want to give. And the concentration of that is what we give. So just so you know, that's also the normal concentration we give to adults. So that 7-year-old was getting close to that weight, that age. Okay, does that make sense? Okay, so everyone's good on drug calcs. You can see there really wasn't any on there, was there?
Yeah, thanks.
Hey, I didn't write the test, but I prepared us. I told you to be prepared for it, right? Because you never know what's going to happen.
I spent like half the weekend trying to do your math that you did up on the paper.
Do your own, no, like I said, do your own math.
No, the funny math you were doing. I was trying to show.
Oh, that's easy.
Yeah, but I couldn't come up with anything besides 25.
What you're saying,
so 7 into 28 is 13. 5 into 25 is 14.
What's 5 into 28?
Well, 5 doesn't go into 28.
Okay, that was my problem. I was trying to put it at 28.
Everyone knows that.
I'm sorry.
Okay, so here's where we're going on this. So now basically what we're doing, we're adding, all we're adding onto this, as I said before, is we're adding the drip set. That's it. That's all we're adding to this calculation we've been doing. Now again, these may be in and out, they're interchangeable in spots. You can put drip set over here, concentration, drug dose, doesn't really matter. As long as you get the formula. And the whole formula aspect is, so you can get everything canceled out. This is usually if it was milligrams, weight-based. It'll always leave you in drops per minute, excuse me. That's what we want to get to, right? So this is the formula. So this is what I want you guys to remember. So instead of concentration being the vial, it's the bag volume and the medication we put into it. Again, if I have 5 milligrams in a 10 cc vial, I don't put the 10 cc up here. I just put the 5 milligrams in here, and that's just the volume of the bag. Okay? So what I want you guys to do is be able to have this formula down that's on the slide. Have that basically, I hate to say rote memorization, but basically memorizing that, and all you do is punch in the numbers where they go, you'll get the right answer for the test. And again, for the test and for the homework, 2.2 kilograms per pound. You have to do that correct, and that's these questions I'm going to give you here. You have to be doing those. Okay? So again, I'm going to write these down. So this would be bag volume over drug on hand. And then we have the dose ordered, whether it's ordered by the doctor, protocol, or whatever, over time. And then we have your drip sets, which is in drops per mil. Okay, so that's the formula we're going to do, and we're going to just do questions now. Okay, so I'm going to pop this one up. You're ordered to give an Isoprel drip at 4 micrograms per minute. You have 1 milligram in 5 ml vial, and you have a 250 cc bag. The patient weighs 176 pounds. At what rate are you going to send your micro drip administration set? So I'm going to set this up on the board as you guys are doing it there. So what is our IV bag? 250, and it goes up on top, and it's 250 mils. And our drug that we're going to put in there, it's actually 1 milligram. In a 5 milliliter vial, there's 1 milligram in a 5 vial. The 5 milliliter, remember, this is going to be, and let me get me right here. This is going to be our distractor, right? So I don't need that. Okay? So if I go back to here, I've got my 250 over, there's my 1 milligram. And what's my ordered dose? 4 micrograms. Okay. So do I need the weight? Is this a weight-based drug?
No.
Okay. So this, again, is a distractor. So my ordered dose is 4 micrograms for 1 minute. And what type of drip set is it?
60.
It's a micro, so it's 60. Macro could be 10 or 15, so I'll specify those. Micros are always 60. So 60 drops per mil. So what is missing in the equation? What else do I have to do?
Convert micrograms to mil.
Perfect. And how, what does this equal?
1,000 micrograms.
1,000. Perfect. So now everything will cancel out, right? Those will cancel out. Those will cancel out, and it'll leave me drops per minute. It's exactly what I wanted, right? Okay, so if this is all you did, now you've made this conversion, multiply across, divide by the bottom. That's it. So everyone should be able to just do that. Use your calculators to do that. If you want to make this a little bit faster as far as things go, this is what I do. I simplify. What's 250 over 1,000? It's equal to 1/4. 4's cancel out, and it leaves me 60. Did everyone get that? Anyone not get 60? Okay.
Shouldn't that be over a minute, not milliliter?
Excuse me, per minute, yes. Thank you. Not a distractor. So did everyone get that? Okay. Minus my little mistake there. So that's basically what we're going to set up every single time. And then we're looking for drops per minute. So that's our setup. So is everyone good with that one? Let's try another one. That's what we're going to do here is we're just going to go through these. So now that same problem with a macro drip set at a 10. How many drops per minute? If we used a 10 drop instead of a 60. How about if we used 15? Perfect. Got that? Because that might be a question you'll see on the test or in the homework. Calculate it with a micro, calculate it with a 10, calculate it with a 15. So let's try another one. Okay, you're ordered to give lidocaine in an IV drip at 2 milligrams per minute. So, switch over to this and this. So my 2 milligrams per minute, that's my ordered dose, right? Is it weight-based? So my patient's weight is a distractor on this one, right? So I can just go ahead and fill in my ordered dose 2 milligrams per 1 minute. I have 1 gram of lidocaine in 4 ml vial, and I have a 250 bag. So how do I set up here? I go 250 bag, right?
No.
Oh, I don't? Are you sure? Okay, good. I'm testing you. So where's the 250 go? Okay, and what goes below it? 1 gram. Okay, and what's my drip set? I heard 60. So what's my conversion need to be? Okay, and how are you going to do that? 1,000 again? So again, if you get to this stage, you do the conversion, you should be able to take the top across and the bottom across. Again, I'm going to go to my simplification. What's this again? 1/4 times here, 1/2. So that's 30. That's my easy simplification. But again, just go across the top. So if that's 30 for a 60 drop set, what if that was 10? 5. What if it was 15? 7.5. You would just substitute this number, so it would be half of 10 or half of 15.
When we get those odd drip numbers like 7.5, round up.
Put 7.5. If you round it up to 8, you'll be close enough. Just put what it is, but
6 1 minute, 6 the next.
yep. So, and that's what the next set is, calculating those areas. So basically all we're doing is we're substituting for 60, for a 10, or for a 15, depending on our drip set. But again, all you have to do is go back to your calculations and use a calculator and straight across. Again, I want these eventually to where you guys can figure these out pretty easy. But initially, if you have to set them up and just take a calculator and go across with the big numbers, do it. I don't want you to simplify too soon and miss the question. I want you to get the answers right. Fair enough? Questions with this? Difficult? Hard? Too easy? In between? Because you know what I'm going to do to test you guys.
Not going to put it on the test. I can do that. I wouldn't know that.
Tell us that it's going to be.
I'm going to do another quiz with you guys because that's how I get to know if you guys know it or not. Okay? So we're going to go through some more of these before I do that, but that's what I want to do today is I want to give you guys another quiz. I don't have to do it in the room. I can send it as homework or some aspect of a practice, but I want you guys to be able to do this. So I'm going to let you guys do this one. So however you do it, come up with the answer, and then let's see how you guys are doing. How you guys doing? Where's your confusion? Did the setup make sense?
Yes. I don't always get the 200 milligrams over the 250 milligrams.
Okay, so that's you have 200 milligrams on hand. That's the drug you're putting into the IV bag to drip.
Okay.
So you get 200 milligrams and you're putting in the mils because that's how you're going to get the medication in. So this is always your med down here. Does that make sense now?
Yeah.
Okay. Yeah, it's right here. So you have, I didn't say the medication you were giving, the dopamine. This should have been 200 milligrams of dopamine. Does that make sense then? Okay. So there's two ways that you guys could have done that, and I showed you both. I could have converted that to 0.4 milligrams, or I can convert this to 200,000. Okay? So what did you guys get for this? 30. Perfect. If anyone didn't get 30, let me know. But use your calculator. Make sure you're doing those calculations across so you're getting that. Is this too easy? Kind of in between? Between? Okay. So don't worry, we got a couple more. So now what happens to our drip rate if we set this to 400 milligrams instead of what do you think? Are you sure?
Yes.
Perfect. Okay? Because we put it down below, it's going to divide, so it's going to reduce that. If we increase the number up here, it should increase that. So whatever goes on the top half should increase it. Whatever goes to the bottom half is going to decrease that. You did your math and it came up to that number? Perfect. So this is also going to decrease this number when I come down. So let's do another one here. So this one's making you think a little bit more, right?
Didn't give us an ampule size.
Give you your what?
It didn't give us an ampule size, did it?
Ampule size always 1 milligram.
Okay.
So your ampule, small, it'll only carry that 1 cc, so it's always 1 milligram. So it makes you think a little bit more, a little stepping on this one, okay?
Is that true for all
Ampules, correct. Of epi. Not all ampules. All ampules of epi, it's correct unless it's not correct. Fair enough?
all the time?
All the time unless it's not. So, and then our bag volume, so now our bag volume is going to be the 100 over 1. Our drug order dose is going to be 5 over 1. And the micro drip administration set is 60 over 1. Is that how everyone set it up? Did your conversion? Made it 100 over 1,000, okay? Or 1/10. 5/10 is 1/2. Half of 60 is 30. So let's do another one. Two-part question on this one.
Our macro drip 15.
We're gonna make it a 10 on this one. Answer's not 30, by the way. Just didn't erase that. So what are you getting as an answer for this? Perfect. So at what rate would you set the administration set? Can you count 100 drips in a minute? You can only do 60 drips in a minute, right? So if you did that, you could always convert it. What if we switched this over to a 15 or 60? We change up the area from going there. But at 100 drops a minute, you're just going to have to calculate that you're getting almost 2 drops, a little bit less than 2 drops coming in. If you have a pump, real easy, right? But if you don't do it by eye, you just have to count a little faster than a minute, slower than 1 a second, a little slower than 2 a second. The other nice thing about this is once you get the drip going, then you're going to set it to adjusted rate. Well, you don't want to do wide open, but you're very close to that, right? Wide open, it would be really flowing. Okay, let's do this one. So what's the difference between this one and the others? Now we're weight-based. So now we have to come in here and we have to figure out this area changes a little bit. So the only thing different with weight-based is we'll take the kilograms of the patient times the dose in whatever the weight is, micrograms per kilogram, milligrams per kilogram, whatever. So all we just did was we just added one more equation in that spot. That's it. So in this case, 176 pounds, how much does that patient weigh in kilograms? 80. So you're going to see a lot of 176, a lot of 220s, 135s, different ones like that come out there. So we set up the equation exactly the same, right? How many you guys are getting? 30? Anyone not there yet? Okay. So I want to make sure we're all on the same pace before I move on. So Chris, if you're having, did you get the formula out?
Yeah, I just tried to put it all together.
Okay, use calculator. Oh, run the calculator across. And that's where I want you guys, go ahead and rely on the calculator for the test. I'm going to teach you, because we've got a lot of time between now and before you guys get out in the field, right? I'm going to teach you how to do these in your head real quick. The nice thing is, too, is how many drips do we do in the field? Tons, right? Okay. So I'm going to go over some of those things with you and get you there. So use your calculator in these, on these test questions in the homework. Did you make the change?
Yeah.
Okay. So this is the other reason why I want you on here to use labeling, is to make sure you're getting them in the right spot, they are crossing out, and you're doing the conversions. Because if you forget to do the conversion, you're going to be off by a decimal point, right? So make sure you're doing that. Did that make sense now? Did you get to this?
Yeah.
Perfect. Everyone got to this? Okay. If you're not or you're having issues, then come talk with me. I'm going to do, let me see, hold on. Okay. I'm going to do one more question here. So let's get this question answered here, and then I'm going to talk to you about a couple other things. Everyone get done? Some people are still working on it? Anybody not there?
Not quite.
What's that?
Not quite.
Not quite. Okay. But you got the formula right.
Yeah.
Okay. Anyone else? I know you're squinting to look at my work. You got it?
Well, yeah, I think so. That's what I got to.
So, and you might have just done it by math there someplace, moving a decimal.
I thought that was a period again.
Where?
I thought it was 1 microgram because I read it too quickly. So,
1 microgram instead of 0.1?
Yeah, so that might be your problem.
No,
I probably should put a 0 in there. I'll change the slide
Chris
Oh,
put
I
it
see what you
in.
did.
and I'll put a
I just
0.
did the micrograms wrong. I did it 0.01 instead of 0.1.
Okay.
So when I changed milligrams.
Threw off a little bit. Okay.
I see what I did.
You got what you got?
I
Okay.
think I did my math wrong because I got the right answer and I did do 1 microgram per kilogram.
Perfect. You got the math there right. Yeah. You did the conversion. So this is the big thing on there. It's really not too hard as goes. This is just putting in the numbers where they fit. Okay? And this is the big thing because these will eventually be on your test. I'm not going to tell Laban when they're going to be on the test, but they will eventually be on your test. Well, it's your homework.
I know. What do you say?
Exactly.
I got it recorded.
So that's basically what I'm looking for here. So I'm going to do one last thing, and then we're going to do a quiz to see how you go. So we increased the dose to 0.2. What's that going to do to my drip rate? Double it. We doubled this number, and it's on the top, so it's going to double here. If we doubled this, it would half that. So think about it on the math, whether it's the denominator or the numerator or whatever they are. I don't even know the numbers. So top or the bottom. Okay? So if we increase the top, whatever we do it by percentage-wise, if we double this, it doubles this. Make sense? Got it? Okay. But again, my safest way is make sure you put it out in this formula so that you get the same answer every single time. Okay, so that's not the one I want. Okay, so this is the thing. If you guys get out of your phones, I want to try this, and this is going to go a couple of questions on here. Do you guys like these games? Okay, good. Because
Yeah, I know. It's stressful.
so fat fingers, just take your time.
Short fingers.
And it's taking a second here to load, so sometimes I just have to start it over here. Play live, proceed. Okay, so you guys have should have join the 449637. There is no time limit on this. It has a timer. Don't follow the time limit. Okay? And once I see 22 names up there, so who is Laser? Okay. All right, I just need to know. I can get everyone else pretty much. I was looking for Blazer,
We're all screwed up.
looking for the dodgeball names.
I know, Chris. I like
The real Chris.
What's with the asterisk, yeah? Also known as. Yeah.
So it should be 22. Someone's still waiting?
Here's the first one.
Who's not on?
That was very sad.
You're still?
I didn't hit the first soup button.
Okay. Is there anyone not on? Because I feel like we have more than 20 people here today, but maybe I'm wrong.
Oh, we got 21 now. Oh, no, we don't. It's Wilson.
Okay. So, all right. Here we go. So yours always seems to take a little bit longer to start, but it'll start.
This time it was user error.
So take your time. Don't rush these. Don't worry about the time. Yeah, and you'll see later you guys can change the theme on it too, to a space background, jungle background. I'd play around with this. I get bored. So far, I'm liking what I'm seeing.
Mine's trying to figure out.
What you got? That's a true one. So, again, the conversation on that one is your time limit. So let me go to that specific, see if I've got that one on there. So if there's one that's dripped per hour, right? If there's one that's dripped per hour, this just changes here to 60 minutes, right? So you're just adding down here. So if it's based on an hour drip, you convert that to minutes. So it'd be 60 down below. Thanks, Matt. You guys are also getting them all jumbled up in orders.
Don't you need a weight?
Don't need no stinking weight. Yeah.
That one.
Yes.
I missed the information.
Okay. So there's also one on dopamine on there. So I'm gonna on the dopamine ones, just kind of skip those because there's something I didn't tell you guys about on that because I wasn't sure that those. I forgot those were on there.
Yes, when I got it right. When you say
Everyone's gonna be different.
you say macro,
Macro is 10. Okay. So this, that's my bad on some of these. Skip there because I did a couple advanced questions. But this is perfect because I get a teaching answer. So that's actually advanced question. So basically, you got to convert this. So you're actually going backwards. Yes. Yep. So this is actually good because I gave you guys, this is the advanced one. I didn't give you the easy one, but this gives me a good learning opportunity here to explain to you guys something. So let's do this. I'm going to resend this one out as homework to you guys. No, I want to teach you guys a couple stuff because I think this is more important. And then I'm going to have you retake this. So some of you guys will get advantage here. But I'm going to stop you guys where you are, and I'm going to resend this one out. Okay? Because I think I want to show you a couple other things real quick. Is that fair enough?
Yeah.
Okay. So.
Game over.
Game over, dude.
Oh, man. It always
Game over.
It's okay.
All right. So here's a couple of different things. So again, having this equation out here, again, if you follow this, this is where it's going to come into play. So this is always in weight-based and such on here. Couple of different things. Some of these equations, and you're going to see this on the homework, where I'm going to give you 30 drops per minute. And I'm going to ask you to find how many milligrams do I put in my bag. All you basically have to do is, unfortunately, it's a math equation, but you got to go backwards to do this. So what you have to do is you've got to get X to basically the other side and 30 onto this side. So as with any math equation, let me just put in some numbers just to make something up here. Let's call this 5 micrograms. And let's say I was using a 60 drop set and I had 30 down here, and I want to find X. Well, to get rid of X on this side, I multiply this side by X. That cancels out here, and my X goes onto this side. To get rid of 30 on this side, I divide by 30, and then I have to divide this side by 30 as well. So it's math, but that's basically how I swap the equation.
Why do we need the
I'm going to give you a reason. So diltiazem, which is one of the equations on there, and this is going to be one of my extra credit assignments to you later. Diltiazem is a medication we give for atrial fib and atrial flutter. We usually give it at about, what's the dose? Well, basically, we usually give it as a bolus, though.
Yeah.
We give it as a bolus. But it's now in our protocols to give it as a drip rate. And it's basically given as a drip rate per hour. So if I tell you I want to get 15 milligrams of diltiazem per hour, how are you going to set that up?
No, I get that part of setting up the drip rate. What I'm saying is going backwards. Why would we need to figure out how many milligrams?
To go back through there?
You just add so much to confuse me. I get the drip rates. I get the
Right.
that. But then trying to figure out how many milligrams we get because of our drip rate,
So
when are we ever going to be in that situation of not knowing how much we do?
the only times that we can do that, but it's figuring out how you're going to fill out an epi drip. So you got to do an epi drip, would be the equation, and you've got to give basically your drip rate on there was given out by a hospital or something like that, and you just need to refill a bag. Something happened to the bag, contaminant, something like that. My question is, do you understand the math and figure out from there?
I got it before, but now I'm getting confused trying to do it backwards.
Okay. So I'll make sure I don't put any of those backwards ones in for you. I'll just get you guys getting straight. But I want you, there is a couple times that you would potentially do it. In Spokane County, probably not, but if you're using critical care transport on the other side, or just in those cases, or some flight medic stuff, there is times where you have to be able to retro back and figure it out. So that's the only reason why I put it on there. On the test questions, there will be no figuring backwards. Fair enough? You may see it on the homework, and you may see it on extra credit, but you won't ever see it on the test. Is that fair? Okay. The other aspect that I'm going to do for you guys that I want to explain is the concentration of dopamine. So to do dopamine correctly, basically it is in a 1,000 milliliter bag, it's 1,600 milligrams. That's the concentration of dopamine. It always is. So usually what we'll do, if we're going to make those pre-filled bags, how big are the pre-filled bags?
250.
250. So we always have 400 milligrams in them. But this is the concentration of the bag. Okay? So basically, on this, if we want to convert this to micrograms, because dopamine is always done in a microgram drip, right? That's basically, if we convert this over to micrograms, right? So here's my 1,600 plus my extra 3. If I cancel out my 3's, my concentration is always 1 in 1,600 micrograms. So it's just a simple way of doing dopamine. It's just one simplified step. Fair enough? So that was one of the concentrations. You have a dopamine bag with a concentration of 1,600 micrograms. Well, that basically means it's 1 over 1,600. So if you ever see dopamine, just a dopamine pre-filled bag, that's your concentration. You can just automatically pop that into here, and now there's no conversion. You got micrograms, you got micrograms. Just another simplified step.
Dopamine is always 1 to
Dopamine is
1,600.
always 1 to 1,600 in a pre-filled bag. It's not always 1 to 1,600 because sometimes I might tell you put 200 in a 250 bag. Now what's my concentration? 1 over 800 micrograms, right? So it could change, but a pre-filled bag is always this. But if I said this here is 200, 3,200 for this.
Real quick, helps my mind focus on that. What is dopamine used for?
Dopamine is used to vasoconstriction. It's got an alpha stimulator under small dosages. It's a beta 2 stimulator and a beta 1 stimulator under a little higher dosage, but it gives you alpha 1 and beta 1 under low dosages. So alpha 1 does what? Vasoconstrict. Beta 1 does what? Increases automaticity, increases contractility of the heart rate. So it works on the heart and it works on the arteries to increase your blood pressure. Yep. So this is for your patient post-arrest who's fluid, has everything in it, their heart rate, or excuse me, their blood pressure isn't going up. This and epi get their blood pressure up. Same thing as levoped as well. Sorry, here and then here.
So just to make sure, so for estimating it, is it a ratio of 1 to 1,600 for milligrams or 1
1 to 1,600 micrograms if it's a pre-filled dopamine bag.
Okay, so it's 1 mil over 1,600.
Yep.
Okay.
But this is micrograms now.
Okay.
Okay?
Not really an important question, but just out of curiosity, is the dopamine that we carry as medication the same as the molecule released by the one side?
No.
Is that ratio something we need to remember for tests?
It will be on there. Again, I'm always going to include in a question like such. So the numbers will all be on there. But again, if you see it's 400 and 250, 800 and 500, 1,600 and 1,000, you can immediately just go to that. It just saves you a step. Just makes things a little bit faster.
I'm really slow on this, I'm sorry.
No worries.
Can you say that again? Not what you just told me. But,
What you said
Which
last
part?
time.
well, at about 9:30 today, I guess like you get the 250 milliliters over the 200, I guess it's micrograms? Would you have-
Milligrams.
That's all, that's just milligrams. And you said that would change the 1 over 1,600 to 1 over 3,200, is that what you said?
So basically, what's this concentration? If I go up to 1,000, now this is 250, that'd be 1,000 mils, and that would be 800 mils. So, excuse me, milligrams. So technically, no, that would be 800 micrograms.
And how did you get from 250 to the 1,000 now? Sorry.
I'm going to take this down here for a second so I get this here. So if I start with 250 milliliters,
Right.
and I put 200 milligrams in them, okay? This is regardless for anything. So that is equal to, if I want to go up to a liter bag to give me a concentration per liter, because it's just simplified, in 1,000 milliliters, basically that's times 4, right?
Oh, okay, because you're talking about going into a liter bag.
I'm doing it giving you a liter bag area to show you what that concentration is, because it's simpler to do than it is this.
All right, yeah, okay. I think that's probably what's doing something.
Okay. So if I go to there, then this is 800. And then that also is equal to be micrograms. Okay. Because with this, it's a little bit harder to get these numbers to make this micrograms now. Now it's 200,000, but 225 isn't as simple as 1/8. That's just where I do it for those concentrations. Fair enough?
Yeah.
Okay. Does everyone have this down? Okay. So that's what I want you to be able to do, because these questions are out there, is be able to take let me pop this. Take a test question like this and be able to pop it into that formula. We already did this one. Okay. So I'll go back in and I'll send you a different TED Ed. I'll go in, I'll take that one out so you don't have to find out backwards to there. So everything's going to go straight forward. And then the other, what's that? Excuse me, the quiz is, sorry. So I'll resend out, thank you. I mix up my words, so please question me every time, because I will say something when I mean something else.
Confused enough.
I don't mean to do that. It's not.
At all.
It's not intentional until it is intentional. Fair enough. So I will resend out that one as a homework thing for you guys to practice. But I am also sending out the TED Ed, which goes over just these questions. It's like an 8-minute TED Ed, and all I do is go over these questions, and I'm just kind of spelling them out again. But that way it gives you guys a chance if you need practice. I'll send it out to everyone. If you've got this down and you've got it, perfect. If you're not quite there, test it just to make sure. And if you need help, then let me know too outside of this. Okay? So where we're going to go from this is once you guys all have this down, then I'm going to teach you what's called the 2 a.m. math. The 2 a.m. math is going to get you to these spots, because when you're doing a dopamine drip rate, do you have time to be doing this? No. When you're doing an epi drip rate, do you have time to be doing this? No. I'm going to show you some quick ways of how you mix it and how you run it. And one of the quickest ways that we'll do is give me a weight in pounds, anybody you want to give me, just any weight.
162.
Okay, so I'm going to stop. So I'm going to re-question this. Okay, I'm going to start off here first. Give me a weight in pounds.
160.
160. So I do that person at a drip rate of 14 per minute, or 1 drop every 4 seconds. That's dopamine. Give me a weight in pounds. 157. I do that person at 13 drops per minute of dopamine at a rate of 5 mics per minute. And again, I do that 1 every 4 drops. Weight in pounds. You got weight. I got weight back here. 400, and I got 456. So I either do your 400 at 38 drops per minute, or basically 1, little bit more, 1 every 2 seconds, and you said 450. So I'm going to do that basically at 43 drops per minute.
I'm here at the 2 a.m. now to call
So-
you.
No.
2 a.m.
So I'm going to teach you guys how you guys should be able to do it just like that. I know Maurice has got these numbers down and figured out. So I'm going to teach you guys all the quick things, same way as I'm going to teach you guys how that 7-year-old kid weighed 25 kilograms. Give me an age and a kid. Any age. I'm going to stop again because I noticed I hear 7 answers. Give me an age and a kid. 8. 8 is going to be, so I got 10, 15, 20, 25, 30, 27.5 kilograms or 27 kilograms for an 8-year-old. Who said weight over here? 12 is above 8. So I'm going to be teaching you guys little things. That's why I call my 2 a.m. math, to where you guys can calculate weight, dosages, drips like this. You guys got to understand how to do it from the basic standpoint, because there's going to be times you're going to do it. If you guys are doing critical care transports over in Idaho, you're doing flight medic stuff, and your pump goes down, you got to be able to calculate this out. Yeah, you maybe have to pull out a piece of paper. I told you one of my medic students was doing it the other day. Their pump went down. He had to sit there and calculate it out real quick. Sometimes you're going to do it, but you have to know the math to be able to find it, especially when you're doing different drips like a heparin drip, a nitro drip, different things like that. But the stuff you guys do is your bread and butter. I want you guys to be able to figure out like this. So when I get out of bed and I climb into the wall because I'm not at home and I realize I'm at the station and have to go have that drip, those are the stuff I want floating in your head on the way to the call if you know it's a call that might need that. So I'll have it so you guys do those numbers. I'm not going to teach you those now, but I am going to teach you those. So you guys will all be just flipping it off the top of your head. And for any one of your medics who don't know the tricks, then you'll surprise them when you get out there. You can quiz them. All right? It will come to you. Yep, and it'll be like, once I tell you how to do it, you'll go like, oh, that was freaking easy. It's like, I'm not very smart. So I just pretend to be. But if I can do these little things, I'm going to teach you guys how to do this. But again, you guys should be able to do it just like that. So questions on any of these drug calcs? Anyone not get the formula down? The biggest thing I can say is memorize that formula. These are easy points on the test when we do put them on there. They're even easier when we don't. Formula is the one up on the board, which is also this one here. So again, that formula, you know this formula, have it memorized, write it down, whatever, get used to it, and just follow it across, and you'll get every question right. And that's my goal.
But I think it's dopamine on my question on the quiz didn't show a drip set.
Dopamine is always dripped at 60 mics. Dopamine is always pre-filled with a micro drip set. So that's another couple of things I'm stepping you guys into of some things you figure out. You can't do dopamine at a 10 drop set or 15. Same as epi in an ampule always comes as 1 milligram.
Unless it doesn't.
Unless it doesn't, but it does. All right. So let's go ahead and take a 5 or 10 minute break. We'll get in there. I want to be starting the labs by 2 at the latest. We got 5 lab groups we're going through. We're going to get through IV bolus. We're going to go through the atomizer. We're going to do trauma assessment. We're going to do another IV area 2 probably for you guys to get into. So we got a bunch of instructors here. There'll be an instructor at every station. And we'll kind of push forward with that. Yeah.
So we're planning to get signed off today.
I'm hoping to get signed off IV bolus. I know we kind of did it as a practice run, and we did math in some groups. Not everyone did that. But I'd like to get on the IV bolus one. You guys at least trying to get signed off, or some of you get signed off. If you don't get it signed off today, that's okay. We'll do it another time. But that's one of the ones that's going to be trying to get signed off. So let's go ahead and take a break. Let's be back at 10:02.